global public health. We have been pleased and honored to partner with them, not just in the wake of COVID-19, but over decades since their founding. And in fact, the U.S., of course, played a significant role in the founding of the WHO over 70 years ago, and that is partly why we're here. World Health Day is a commemoration of that very founding. Of course, with the theme of this year, Our Planet, Our Health, we want to look more closely at the intersection of health and climate. But of course, both Secretary Becerra and Director General Tedros will be speaking to a range of health issues as part of today's briefing. So without further ado, I would like to invite both gentlemen to the stage. Again, Secretary Xavier Becerra, the Secretary of Health and Human Services here for the United States government, and Director General Dr. Tedros from the World Health Organization. Thank you very much again.
I'm going to start by mentioning why we are wearing masks. So if I can thank Assistant Secretary Lois Pace for her work on global affairs here with the Department of Health and Human Services, and for her leadership on these crucial issues as we work with the World Health Organization. I want to welcome Dr. Tedros here to the U.S. It's been a few years since he had a chance to be in the country, and thank him again for all the work that he is doing in leading the world and all the countries that are concerned about not just health, but obviously COVID. And I wanted to mention the masks out of precaution, although I think both of us are both vaccinated and boosted. We are wearing masks because each of us has been close to someone who tested positive recently. We have both tested negative as late as today, but just out of precaution, we will wear the mask while we're not speaking. Dr. Tedros, thank you for being here at the Department of Health and Human Services. I am honored and pleased to celebrate this year's World Health Day with you and our valued partners of the World Health Organization. I'd actually like to begin my remarks with a few comments about the situation in Ukraine, where just this week we've witnessed even more unconscionable cruelty. Today, the United Nations rightfully suspended Russia from the UN Human Rights Council. As Ambassador Thomas Greenfield noted this week, Russia's position on the Council was the height of hypocrisy, and we cannot let this brazen inhumanity go without consequences. The U.S. stands with the people of Ukraine, and we join others in condemning Russia's attacks on health facilities, including maternity and children's hospitals, and certainly the cruelty directly towards human beings. I specifically want to thank the WHO and other UN humanitarian agencies and partners who, with the support of our CDC, are working tirelessly to provide life-saving supplies and services to affected communities throughout Ukraine. This year's World Health Day theme is Our Planet, Our Health. It resonates deeply with us here at HHS. We know that the challenges we face won't be solved by one leader or one country alone, but by the world coming together and fighting for what's right. That's why I was pleased to host the Director General and his senior advisors this week to discuss how the U.S. and the WHO can work more closely together to promote global health. Just 1 year into the Biden administration, the United States is leading the effort to strengthen the international health regulations of 2005, which are so important for us to work together as a community. And in the spirit of One Planet, One Health, President Biden and the United States have been at the forefront in the fight against COVID-19 worldwide. As we detailed at the President's COVID-19 briefing earlier this week, the U.S. was the first country in the world to donate a significant amount of our own vaccine supply to the world, to purchase 1 billion Pfizer vaccine doses to donate to other countries, to broker a deal with the U.S. manufacturer and COVAX to get vaccines into humanitarian zones, and to give up our own place in line for delivery of doses we ordered, enabling the African Union to more quickly access over 100 million Moderna vaccine doses. In addition, this week, we announced that we will be the first nation to donate tens of millions of vaccines for children, pediatric COVID-19 vaccines, to low and lower middle income countries for free. That's leadership, but our fight isn't over. While we are grateful for the Senate's latest work on a $10 billion bipartisan plan to help meet some of the country's COVID needs, significantly more is needed to fund both our domestic response and our global response. This virus knows no borders, and it's in our national interest to vaccinate the world and protect against future variants. Without global funding, USAID won't have resources to get more shots in arms around the world. We'll be forced to scale back our work providing oxygen and antiviral pills to others in need. We will lack the funding to provide rapid testing to countries in need. At every turn, we've worked with global partners to share not just our vaccine supply, but our knowledge and technologies. During the virtual COVID-19 dialogue with ministers of health, the United States was pleased to announce that the National Institutes of Health has offered to license several COVID-19 technologies to the COVID-19 Technology Access Pool, or CTAP. Discussions are still ongoing, but we hope to conclude this process as quickly as possible. But we also know that COVID-19 is not the only threat the world faces today. Our planet is in peril. That's why President Biden committed to a 50% reduction in carbon emissions by 2030 and the decarbonization of federal facilities and procurement, all with the focus on racial and social equity. Because we know climate change is health policy as well. The Biden-Harris administration is also working to support gender equity here at home and around the world. In October of last year, we strengthened Title X, our domestic family planning program, to restore access to equitable, affordable, quality family planning services for more Americans. And in January, I launched the first ever HHS task force on reproductive health care access, which Assistant Secretary for Global Affairs Pace co-chairs with Admiral Rachel Levine, our Assistant Secretary for Health. Half a century ago, then U.S. Surgeon General Luther Terry addressed the World Health Assembly during the fight against smallpox. What he said was prescient. We have the knowledge, and knowledge represents responsibility. Those words are as true today as they were then. We have the knowledge, we have the responsibility, and we have the will to build a stronger global health system, one that can prevent, not just prevent, but be prepared for the next outbreak before it becomes a pandemic. One that lifts up not just the wealthy and the healthy, but the meek and the marginalized. But only if we work together. We are lucky to have such a strong partner in the World Health Organization and Director General Tedros as we build a healthier world. So please join me in giving a warm U.S. welcome to a good friend of the United States and a champion for global health, Dr. Tedros. Let us clean that.
Just in one moment, in an abundance of caution, we're also just going to make sure we are using all of our sanitary tools available. Okay.
Thank you so much, Secretary Becerra, and good afternoon, everyone. I also thank Assistant Secretary for Global Affairs, Lois Pace, and Assistant Secretary for Public Affairs, Sarah Lovenheim. It's a real pleasure to be here in Washington, D.C. on World Health Day and celebrating World Health Day with my good friend Javier. Over the past few days, I have had a series of very productive meetings with representatives of the administration, senators, House members, and other leaders. Of course, starting from our own partner, from the HHS, from Secretary Becerra on Monday. We renewed old friendships and forged new ones. We discussed the COVID-19 pandemic, the war in Ukraine, and WHO's 5 major priorities for the next 5 years, including supporting countries to make a paradigm shift towards promoting health, preventing disease, and not just treating it. Radically reorienting health systems towards primary health care, strengthening global capacities for pandemic preparedness and response, harnessing the power of science, research, innovation, data, and digital technologies for health, and continuing to strengthen WHO as the leading and directing authority on global health. World Health Day marks the day that the Constitution of the World Health Organization came into effect on 7th of April 1948. Although our headquarters are in Switzerland, in one way, WHO was born here in the United States. It was in 1945, during the conference to establish the United Nations in San Francisco, that the idea of an international health organization was first proposed. And at the International Health Conference in New York City the following year, the Constitution of the World Health Organization was adopted by 51 members of the UN, including the United States. For the past 75 years, the United States has been a strong partner in global health. The US played a pivotal role in eradicating smallpox, which remains one of the greatest achievements in the history of global health. The US has continued to be a leader in global health through PEPFAR, the President's Emergency Plan for AIDS Relief, as well as its support for the response to malaria, TB, polio, and many other diseases. The US has also been a strong supporter for WHO's work to respond to health emergencies, including the war in Ukraine. With support from the United States, WHO is working with Ukraine's Ministry of Health to keep the country's health system running. And we're working with neighboring countries to support access to care for refugees. WHO and our partners have so far delivered more than 180 metric tons of medical supplies to the hardest hit areas in Ukraine, and we're preparing to deliver more. We are outraged that attacks on health care are continuing. Today, on the 42nd day of the invasion of Ukraine by Russia, we crossed a grim milestone of more than 100 attacks. As of now, WHO has verified 103 incidents of attacks on healthcare, with 73 people killed and 51 injured, including health workers and patients. Attacks on healthcare are a violation of international humanitarian law. Peace is the only way forward. I again call on the Russian Federation to stop the war. As Secretary Becerra described, the United States has long been a strong supporter of the global response to the COVID-19 pandemic. The United States is the largest financial donor to the ACT Accelerator since it began, and the largest donor of vaccines to COVAX, as Javier outlined. And we continue to look to the US for its support to end the pandemic globally and to address the many other challenges to health we face. Doing this is in the interest of the United States itself. I'm painfully aware that the pandemic has taken a heavy toll here in the US. I offer my deep condolences to all Americans who have lost someone they love. And I offer my deep appreciation and respect to every health worker who has put themselves in the harm's way to serve others in the course of the pandemic. COVID is a powerful demonstration that when health is at risk, everything is at risk. The pandemic has highlighted the intimate links between the health of humans, animals, and the environment. And yet, we're rapidly making the planet on which all life depends uninhabitable. Which is why World Health Day 2020's theme is Our Planet, Our Health. The climate crisis is a health crisis. Air pollution kills 7 million people every year, and 99% of the world's population breathes unhealthy air, mainly as a result of burning fossil fuels. Our warming world is facilitating the spread of mosquitoes and the disease they carry. Extreme weather events, biodiversity loss, land degradation, and water scarcity are displacing people and damaging their health. Systems that produce highly processed, unhealthy foods are driving a wave of obesity, increasing cancer and heart disease, and generating 1/3 of greenhouse gas emissions. There are solutions at hand. WHO's manifesto for a healthy recovery from COVID-19 recommends more than 80 concrete actions governments can take in 6 policy areas, with dividends for the health of our planet and the health of humans. The health sector must lead by example, and I applaud the United States under the leadership of Admiral Rachel Levin for its commitment to decarbonizing its health system as part of WHO's COP26 health program. At WHO, we have also committed to becoming carbon neutral by 2030. This World Health Day, as the world recovers and rebuilds from the pandemic, we have a choice. We can go back to the way things were, or we can change course. We can create societies, economies, and products that nurture health and well-being, and stop subsidizing those that destroy it. Because we cannot afford to pump carbon into the atmosphere at the same rate and still breathe clean air. We must choose. We cannot afford the same patterns of consumption and expect less diabetes, hypertension, heart disease, and cancer. We must choose. We cannot afford ever deepening inequalities, and expect continued prosperity, we must choose. And so this World Health Day, we call on all governments to choose our planet, our health. Our planet, our health. I thank you, Secretary, again, and glad to be with you and celebrating the World Health Day with you. And thank you also to the press who joined us today.
Thank you so much. At this time, we will open the floor to questions. It looks like we've got one question over there from Robert at Fierce Healthcare.
Hi, thanks for taking my question. This is for Secretary Becerra. Congress has just left town without passing a COVID relief bill that does not include $5 billion for global aid. Can you tell me how that lack of funding is going to get more specific and how that lack of funding is going to impact your efforts? And also, you spoke about how you need more funding. Right now, there's no plans for another round of relief funding in Congress. How much do you think that you need to help get us over the hump?
Robert, thanks for the question. Is it on? Yeah, thanks for the question. The numbers speak for themselves. We've been pretty clear with Congress and the public that we have been depleting the resources provided principally now through the American Rescue Plan now for some time. We alerted Congress quite some time ago, and at this stage we have had to take actions as a result of lacking the funding to maintain some of the programs and services that Americans have counted on. All those doctors, hospitals, pharmacists, nursing homes, long care centers, community health centers that were relying on the Provider Relief Fund that Congress enacted to help reimburse them for some of the COVID-related costs. Those have now been stopped. The claims and no longer are being accepted as of this week for even vaccines. 2 weeks ago, we halted taking claims for testing and treatment. We extended the timeline for vaccinations an extra 2 weeks. And over that course of time, we received millions of applications for reimbursement. And so that is now a fund where we are going to process what we have, but we can't accept more. We are having to limit the purchase of some of the therapeutic treatments that we know are successful in helping people stay away from a hospital after they become infected, and in many cases can save a life. We can no longer make the advanced purchases as directly and in the bulk sums that we have in the past, which means we stand a chance to now get in the back of the line for some of those therapies. We've been at the front of the line. We've been able to lock in millions of those in advance because we put down the money early. We are now having to scale back the idea of how much testing we can do. The notion of doing test and treat, which now we're capable of doing, so that if you test, immediately after you test, and if you test positive, you can actually get treated. That's in jeopardy as well. And certainly the continued provision of N95 masks will be put in jeopardy. Vaccines, we were fortunate we made early purchases. But at the same time, if we continue to move towards a second boost for the entire population, we would not have the capacity to meet the need there. And so all of these things are hitting us. And even though we still have some money as we try to extend as far as we can, we're not able to do the forecasting and the early investment that we did before that always kept Americans where they needed to be, ready to get the supply and the services they needed. And in terms of Congress going home, well, the numbers speak for themselves. And having been a former member of the chamber, I know how difficult sometimes it can be to pass critical legislation. But we can make a choice. We can, as I heard one member of Congress say yesterday, crush COVID and finish the job that we seem to be getting close to doing, or we can let it surge back. And I think everyone understands what it means if COVID surges back or some new variant comes around. And so it's pretty obvious. The numbers speak for themselves.
We all have to do what we can. We have a responsibility, so everybody's got their role. We hope everyone will fulfill their responsibility.
Thank you, Secretary. Our next question comes from Simon Ateva. with
And
Today
Sarah,
News
could we make
Africa.
sure we go back and forth? So if there was a question for me, if someone has a question for the Secretary General, we go to that question and back and forth, or unless it's for both.
Sure.
Dr. Tedros, for doing this, and glad to see you in person for the first time. And also glad to see Dr. Mike Ryan and Dr. Maria Van Kerkhove here in DC. I know it was really hard to do those press briefings for 2 years every day, so thank you. Dr. Tedros, first off, are you going to meet with President Biden? If not, why not? And also, I know you've consistently said President Biden and the U.S. have done a lot to beat COVID-19 around the world, specifically in Africa. But as recently as last week, you also lamented that more than 80% of people in Africa have not received a single shot of the COVID-19 vaccine. So my question is, yes, the U.S. has done a lot. Yes, President Biden has done a lot. But have they done enough, and can they do more? And if you can give us an update on the Russian vaccine. I know Russia is under sanction right now. Is the Sputnik vaccine also under sanction, or are people still using it around the world? And if you can give us a brief update on the Tigray blockade. I know you've been lamenting that
How about you let him
access
answer
on the
one or
Tigray.
two questions?
Thank you.
Okay. Need a microphone.
Yeah, thank you so much. So I will, it's many questions, by the way. So, I would have loved to meet President Biden, but our programs couldn't align. He was he's very busy, as you can imagine. But I have met, starting from Secretary Becerra, a good number of colleagues from the administration, to have a very candid discussion and also strengthen our cooperation. So next time, I hope our programs will align. But thank His Excellency the President personally. As you know, it was during the day of his inauguration that he signed the letter to reverse the previous administration's decision to continue with WHO. But not only that, the following day we had a call from the Vice President. I spoke to her, and also the same day, Tony Fauci spoke to the board and announced the return of the US to WHO. So that's a strong commitment, and since then, not only COVID, the contribution to many of the other health challenges is really big. If you take COVID alone, the contribution from the US is the largest. So it has done its best. It's continuing to do its best. Of course, as you said, especially in Africa, we have a large proportion of people who have not been vaccinated, 83%. But I can assure you that there is strong commitment from his administration. And we will continue to get the support and make sure that the unvaccinated are vaccinated based on the target we have set for ourselves globally, the 70%. And you can hear this, by the way, in all levels of the administration. We discussed this with Secretary Becerra. The commitment, US commitment is full. And I also met with Secretary Yellen, and the commitment is really strong. So it's the whole government is behind this, and we hope to achieve the 70% and end this pandemic, the acute phase of it, this year. Then on vaccine, Russian vaccine. We haven't yet done the inspection. I think the inspection team was supposed to go a few days before the invasion, and there is no way that we can proceed now, so everything is on hold. On Tigray, as you know, Tigray has been under siege by Eritrean and Ethiopian forces for more than 500 days now. This is the longest and the worst siege in modern history. Maybe I can personalize it. You may be surprised if I tell you almost all of my relatives who live in Tigray, I haven't spoken to them in 500 days because telecom is cut off. There is no media allowed into Tigray. There is a problem with medicine, access to medicine. There is no medicine. No banking services. Relatives asked for support. I couldn't even send money because there is no banking service. It's basics. It's very tragic. I don't know even what word to use. Of course, the international community is trying, but it's not enough. I cannot compare it with Ukraine. Of course, Ukraine is more problem for the world. And having the right attention on Ukraine is important. I support. But a fraction of that attention to Ethiopia, Tigray, would be needed. Without any exaggeration, for more than 500 days under siege, in darkness, no media, the people who are dying there is unbelievable. I don't know, maybe you have seen people being burned alive, because they were Tigrayans, nothing else. They haven't done anything. People were shot, being shot, maybe you have seen the videos, atrocities, massacre. So the situation is getting worse. Of course, I welcome the delivery of 20 trucks to Tigray 10 days ago. But the need is much more than that. That doesn't cover even 1%. But since 10 days, except the 20 trucks, nothing has been delivered so far. So I hope the world will give more attention, at least a fraction of what's being given to Ukraine, because every life is the same. It's a serious humanitarian crisis, and I hope the world will give attention. Thank you for the question, but I'm sorry for taking so much time. Thank you.
Thank you. Secretary, do you have anything to add? We have just a few more minutes, and then we'll have to close, so we probably have time for one more.
Why don't we see if we can get a question or two in, and we'll try to be brief.
Okay, great. Alex Tin from CBS News.
Hi, thanks for doing this. First, Mr. Secretary, can you clarify the details of where and when you two had that close contact that prompted the masks? And were there any other HHS or WHO staff who were in close contact at that time? And then for the Director General, the FDA held a meeting yesterday. A member of the HUTAG COVAC was there and spoke about the potential of a booster strain update. It sounds like there's a chance the United States may unilaterally decide to update its booster strain if there's no recommendation from the TAG COVAC by the early summer. What do you think of that plan? Do you think it's a realistic possibility we won't have a recommendation? Thanks so much.
I'll be brief. At a ceremony, was it a couple days ago at the White House for signing of an executive order to get rid of the family glitch in the law that prevents a number of family members from being able to access affordable health care, along with the relative in the family who's working. I sat next to Speaker Pelosi. Speaker Pelosi recently announced that she has tested positive. out of an abundance of caution, although I feel no symptoms. We're taking all the precautions, including the testing, and we'll do that as long as necessary to make sure I'm clear. Director General, go right ahead.
On the FDA, maybe if you would like to.
If you don't, I'll do cleanup if there's anything more I need to say after you.
Okay, because FDA is a bit internal, so that's why I wanted you to speak first. But I think we encourage countries to decide based on their situation, tailored to their situation. And I hope they're reading the situation properly and proposing. If the recommendation from the TAC comes, fine. If it doesn't, I think there will be a way of balancing it. Thank you.
And I'll simply add that the FDA, very independent agency, they'll do what they think best that's safe and effective. And then our CDC will act based on what they hear from the FDA, and we'll make a decision if there's a recommendation for the American public. But we'll wait for the FDA to wait for the science to guide it, and that science includes data coming from international sources as well.
Okay, we're going to take one last question. If you can please state your name right there and your outlet. Thank you.
Hi, my name is Erin Durkin. I'm from National Journal. This is probably for both of you. You both have spoken about how the U.S. is a strong leader on the COVID global front. Considering that Congress, as someone pointed out earlier, is leaving town without a plan for additional global COVID aid, could this make it harder on both of you to convince U.S. allies and international partners to commit more resources as well and to step up their response if Congress is unable to agree to additional funding?
Gigi, should I start? So what's the saying? Failure is not an option here. I don't think anyone wants to go back to lockdowns and watching their loved ones pass, not being able to be with them when they're in their greatest need. We can't go back to that. We know what it takes to avoid that. We've got the tools in place. The president has made it possible for Americans to have everything at their disposal to be safe. Congress has, on a bipartisan basis for the last 2+ years, taken the measures necessary to make sure we have the tools. Why they would stop when we're on the 1-yard line ready to score the touchdown that really, as I mentioned earlier, lets us crush COVID and pull the team off the field, it makes no sense. I have faith that Congress will do what it must. I just hope that faith is rewarded quickly, because every time we delay is a step further behind that we are in crushing COVID. Whether it's the purchase in advance of the different therapies that we need, or making tests available, or whether it's simply getting ready for what might come next. When we take the team off the field, we cannot perform. And I hope that when Congress comes back, they will quickly make an assessment that we need these resources and need them quickly, and they'll continue to provide what we need to finish the job. DG.
Yeah, I think you have said it all. I still believe that Congress will take this seriously, and there will be some outcome, because the U.S. leadership also motivates others. As you know, for instance, Global Fund, a third of contribution to Global Fund replenishment is from the U.S., and the rest of the world covers the 2/3. And I hope when Congress decides, that will motivate the rest of the world, and we will have hopefully complete funding of the $15 billion gap we see in ACT-A for vaccines, therapeutics, and diagnostics. So I look forward to a good outcome. We have spoken to as many members as possible. It's still in the process, and we hope the administration will get the support as per its request. Thank you.
Thank you. At this time, we are out of time for questions, unfortunately. If you have any questions, please be in touch with us at our HHS press shop, media@hhs.gov. We're happy to help direct your questions accordingly. Secretary, is there anything you want to add?
I want to thank everyone for participating, but principally want to say a big thank you to Director General Tedros for taking the time to be in the U.S. to meet with so many leaders here, and for gracing us here at HHS with his president and his team. Thank you to his team for everything they do every day to help the world get past this pandemic. Thank you.
Thank you.